Good afternoon, everybody. This research was made by the Radiology Department of the Algarve University. I'm here on behalf of a student who could not be here, and our theme is patients' knowledge about ultrasound, CT, and MRI. Our main objectives for this study were to evaluate patients' search for information prior to the examination, evaluate patients' understanding of general aspects about the examination, and then correlate patients' level of knowledge with attitude towards that examination. We also correlate factors such as age, academic level, with knowledge about the examination. We used the quantitative, descriptive, and non-experimental study to access the level of knowledge, and we used a self-applied questionnaire developed in 2001, which was translated and validated to the Portuguese language. Our sample was composed of 143 outpatients who performed ultrasound exams, CT, and MRI. The questionnaire was divided in two sections, one about demographics, composed by question, and then another one composed by questions related to the examinations. Most of these sections included 15 main questions related to general aspects of the examinations based on true, false, or don't know answers, and were interpreted and statistically analyzed throughout descriptive statistics like phi and Cramer's V. Regarding the ultrasound, almost half of the sample knew that there was no ionizing radiation involved. 36.4% did not know if radiation would be used to perform the scan, as well as half of the patients do not know if contrast media is required for this scan. Here we have a graphic with the main results. Patients knew that they were always in contact with the person doing the exam. Almost everyone knew the probe was required. Most of the patients did not know if contrast media was injected, and slight 40% think that do not use ionizing radiation. For computed tomography, lower results were observed regarding the use of ionizing radiation. 56% of the participants do not know if radiation was involved, and 85.4% stated that they had communication with the professional who was doing the exam. A lot of the patients did not know if the CT used radiation. Some of them thought that the professional was with them within the room while doing the scan, while doing the CT examination, but they knew they had chances of communication with the radiographer even if they did not see him. Regarding magnetic resonance imaging, more than half of the participants knew that the professional is not present in the scanning room, that the table will move throughout the scan, and that they will be awake during the procedure. Also, that there will be breathing instructions and that no metal items are allowed in the scanning area. This is the results from the MRI. Most of them thought the radiographer was present during the exam in the room, and they knew that communication could be established between the radiographer and the patient. Most of the patients also thought that ionizing radiation would be used, which is not the case. So in conclusion, patients are minimally informed about the general aspects of the exams that they perform, especially when it comes to CT or MRI. Some of the demographic factors like the schooling, previous experience, if they had already done the exam or not, influence participants' knowledge about the three modality study. As a final reflection, while patients' information about imaging technique is growing, it's still necessary to diffuse and educate the general population about them, enabling the patient to become more active and involved in the clinical information and decisions. This is our references. Like my colleague Vitor, I would like you to visit the south of Portugal. This is Lagoa. It's not Porto, but it's the most beautiful region in Portugal. This is where he goes on vacation. I met him there. Thank you.